Hi, I'm Dr. Paul Howard, a real board-certified plastic surgeon in Birmingham, Alabama. Welcome to my Faceliftology video blog. Welcome to today's Faceliftology video blog. Today we're going to talk about facelift recovery. The most important decision that a patient can make in regards to recovering from a facelift is the choice of the surgeon who performs the facelift. This is important because that surgeon will determine the operation and the anesthesia involved. It is our opinion that general anesthesia is not the proper anesthesia for facelift recovery. With general anesthesia, as we've seen over many years, it's a longer post-operative recovery. There's more bruising, more swelling, and the drugs stay in your system longer and it's harder to get over. A decade or so ago, we changed to a system where we do not do general anesthesia, but we do local anesthesia with some sedation. In this situation, we can get people with less swelling, less bruising, and they can be back amongst their friends with makeup in a faster period of time. The second most important thing we look at when we talk to patients about facelift is whether or not they smoke. Now, we have a lot of ex-smokers, and that's good, but people who continue to smoke to this day are not good candidates for facelifts. The reason is that we depend on 100% perfect healing when we do a facelift, and we can't hide a thing about it. And if the patient does smoke cigarettes during the period of time before surgery or after, it affects wound healing. It's a very known fact. They get more swelling, more bruising, and we can't keep our promises regarding recovery if you smoke cigarettes. This is also true for secondhand smoke. We've seen in many cases over the years that people who are around people who smoke cigarettes during their recovery do not do as well as those who are not around smokers. Just being in the presence of smoke and tobacco is probably a bad thing for facelift recovery. As a general rule, the basic principles of getting well after surgery are the same for everybody. Good health, good sleep habits, taking vitamins, and such as that are all important. It's also important that one stop herbal supplements prior to surgery. Many of these Chinese and otherwise herbal supplements do things that we're not sure, and it's just better to make sure we don't take anything that could affect bruising or swelling or healing. Sleeping is one of the most important things that we can have people take care of themselves after surgery. It's important that when you sleep on your back to protect your face. It's very important to sleep with your head elevated at least 30 degrees, and that can be done easily in a recliner or with 2 or 3 pillows behind your back. Either way is fine, but it's very important to sleep this way. It's also important that during your sleep early after surgery that people are restless, some of them taking medications that make them not sleep as well. And during that period, we've had a lot of people that can unavoidably and unexpectedly cause trauma to their incisions around their ears while they sleep. This sleep trauma is a fairly common thing, and to protect you against it, we ask everybody to wrap their head for the first 2 weeks at night after surgery. They don't have to do it during the day, but at night when unexpected things happen, we have people wrap their head for the first 2 weeks until healing is well underway. As a rule, when we do surgery, the general things that you do for any kind of surgery are applicable to plastic surgery. In this regard, everybody, I believe, everybody that should have a strong support system, especially when having facial surgery. The reason for this is that facial surgery is very, very emotional, and it can be very hard to get over the first 2 or 3, 4 days of surgery when the effects of the surgery aren't able to be seen. All people can see is a little bit of swelling and stitches. It's important to have a very, very active support group. That can be family, it can be friends. As long as somebody around you is actively in support of your decision to do this facial surgery, then people heal better. Negativity after surgery, no matter how it comes, is always bad for healing. And then it takes longer for people to be able to look in the mirror and see the positive results of their surgery when there's negativity going on around them. Having a facelift is one of the most positive things that you can do for yourself, and looking younger is not a sin. Thanks for joining us today in our Faceliftology video blog, and I hope to see you next time.